This morning I want to teach you about a subject that I didn't realize was on the NCLEX, so I really need to drive this point home, and that is the difference between disaster prevention versus disaster management. This is on the NCLEX, so let's get into this session. Good morning, my fellow nurses and nursing students. I'm your host and NCLEX tutor, Annalise Garrison. And this morning, we're going to talk about disaster management and disaster prevention. What is the difference between disaster prevention and disaster management? Well, prevention, in a nutshell, has to do with the training and the policies of what people do in the event of a disaster, and disaster management has to do with the organization or the action taken when there actually is a disaster. So, reading from an insert from my e-booklet that I have in your tutoring section, your email, I'm just going to go ahead and read it and explain to it as I read it. Okay? To achieve effective disaster management, organization is key. All personnel must be trained, and all personnel must know their roles. Now, I'm talking about disaster prevention here. What are the 3 levels of disaster prevention? And that is primary prevention is the first phase. What is primary prevention? The nurse participates in the development of a disaster plan. Train first and second responders triage and basic first aid. Educate personnel about shelter management and educate the public about the disaster plan and the personal preparation for the disaster. Now, this is the training. All right. So the first phase is what? Primary prevention. Training the public, training the personnel. This is what we're going to do. This is how we're going to do it. This is where we train the personnel in CPR, in disaster drills, right? Primary prevention. Secondary prevention is the nurse triages either at the scene or at the hospital. So this is the action that the medical professionals take when there is a disaster. Secondary prevention. The hospital nurses and doctors will treat the injuries. This is secondary prevention. The public will be told what to do if there is a disaster. Go to this shelter, go to this church, go to this gymnasium, whatever the case may be. In case there's a tornado, this is what the public is going to do, right? This is secondary prevention. This is what the medical personnel is going to do. Triage this way or triage that way. Triage at the scene. Triage at the hospital. Right? This is what's known as secondary prevention. And tertiary prevention consists of all situations that need follow-up on perhaps the entire multidisciplinary team for severe injuries and psychological problems or recovery assistance, and even education on how to prevent further disasters. So, tertiary prevention is the follow-up given to what actually happened in the disaster. Okay? So, in order to have effective disaster management, organization is key. So, we teach and we train and we write the policies when we do disaster prevention. And in those, the 3 levels that are involved in disaster prevention is primary prevention, secondary prevention, and tertiary prevention. Okay? Now that is disaster prevention. How does that differ from when the NCLEX asks us questions about disaster management? What is the difference between prevention and management? So let's discuss management. Now, the overall picture when discussing disaster management, there's 3 levels, and that is disaster preparedness, disaster response, and disaster recovery. Reading from the booklet I gave you, I'm just going to read it here, and then we can discuss it in our tutoring session, okay? Disaster preparedness is an emergency plan worked out with you, your family, the public, your place of employment. This is what we're going to do when the disaster strikes. Not always can we prevent a disaster. Sometimes a disaster happens. So disaster preparedness is what we're going to actually do. Stockpile food, have enough food for 3-4 days. Go to this shelter. This is our disaster plan, right? Let's see. Once prepared, practice, and more practice as many elements of the plan as possible. Okay? Once you prepare, like I said, prevention. Practice, practice, practice. The training, right? So, what is our second level, disaster response? In the second phase of the disaster management cycle, it consists of a number of elements. For example, warning, evacuation, search and rescue, providing immediate assistance, assessing damage, continuing assistance, and the immediate restoration of the infrastructure. The aim of emergency response is to provide immediate assistance to maintain life, improve health, and support the morale of the affected population. The focus of the response phase is on meeting the basic needs of the people and more permanent and until a more permanent and sustainable solution can be found. This is what the disaster response consists of. Addressing the immediate concerns until a more permanent solution can be found. And disaster recovery involves a set of policies, procedures, and tools to continue recovery or continuation of vital technology and infrastructure and systems following a natural or human-induced disaster. A natural disaster would be a tornado, for example. A human-induced disaster would be COVID-19, if indeed it came from a lab in China. That is an example of a human-induced disaster. So there you have it, folks. That's the difference between disaster prevention and disaster management. What I want you to take away is prevention is the training and the policies, and management is the organized action of it all. That's what I really want you to take away from this video. All right. God bless you in your studies, and I'll see you in the next video.